Arun Swaminathan. I'm an assistant professor of neurology at the University of Nebraska. I've trained at the University of Kentucky. That's where I did my initial training in neurology. After that, I moved on to the University of Pennsylvania to do my fellowship in treating seizures. That would be my main focus. Epilepsy is a common condition. We'd expect that about 1% of the population would have seizures at any point of time. And that means we're looking at about 3 million people with seizures in the United States. In addition to that, there'd be a bunch of other people who would have symptoms that would resemble seizures, or people having seizures from a host of different reasons besides epilepsy. So patients like these would need a comprehensive evaluation, and that's where I'd come in. With the neurology, we treat seizures, which is my specialty. There are so many different options we offer: new medications, brain surgery, the use of computer-based devices to treat seizures. There's just a wide variety of options out there, and I'm not even mentioning the various research trials we do, like for things like cannabinoids or so forth. There's no one-size-fits-all treatment plan for patients. There are aspects of treatment that overlap between patients, but the most important thing for me would be, the first time I see them, would be to get to know them individually, what kind of life they have, what do they do for work, what's their family life like, do they have children, are they able to function on a day-to-day basis, how has having seizures affected their daily life. It may sound a bit cliched, but I'd want to know the human being behind the patient. Being at an academic center gives us access to a wide variety of doctors with different types of training. For example, in my field, if I were treating patients with seizures, I'd have access to good neuropsychologists, neurosurgeons, MRI experts, people with access to good EEG. I'd have access to a large variety of experts to help treat my patients. Besides that, being in an academic center also helps because I'd be working with great doctors in training. They'd keep me sharp on my toes. I'd have to stay at the top of my game to make sure I could train them well and offer the best treatment to my patients.